It's going.
Let's go, man.
You're live.
Okay. We'll start with the Pledge of Allegiance.
We allegiance to the flag of the United States and to the republic which stands one nation under God, indivisible, with liberty and justice for all.
We'll call the meeting to order. It's the 7:41. Yeah. So, want to welcome everybody. We're in elevated platform now. So, can we spend a few minutes to review the minutes of the last meeting, or are we okay with that?
I think let's start with Sheila taking attendance. Sheila, you
Yeah,
want
go
to start
ahead.
by taking attendance?
Yeah, I've taken attendance.
Okay. All right. All right. So, any questions?
Yes.
I do.
You have to announce it.
You have to call the roll.
Oh,
Okay.
okay.
All right.
All right. Okay, we'll do all those present. Dr. Forright?
Here.
Dr. McCullough?
Here.
Dr. Hess? Marla?
Here.
Philip Golden?
Here.
Dr. Ninjakubi?
Yeah.
Dr. Vavilala?
Here.
Amishi? Hello. Do I need to do
Yeah.
the rest of these?
Everybody.
Michelle Arm? Here. Denise Julie?
Here.
And then Sheila Paul, the administrator. TJ Whitmore? Not present. And Leona Chandler Felton? Not present.
All right. So, any comments, omissions, or issues related to the previous minutes of the last meeting? None? Can we entertain a
Excuse
motion?
me, we can't hear anything here. Do you have microphones up there?
Sure, that's what it takes.
It doesn't pick it. It might take a second.
Can you hear me now? All right. All right. So, can we, any motion to
I make a motion, we approve the minutes.
any second? All in favor?
Aye.
The ayes have it. We're in old business.
That's me.
Yeah, okay, good. So old business related to the proposal for salary adjustment.
So this is a carryover from our last meeting, and I apologize, I did not provide you guys with enough background is the reason for the salary adjustment request. And then also I provided you with some more comparisons from different counties. As we mentioned last time, these particular positions don't have a lot of comparisons to pull from, just because every county is made up differently, have different positions. So these were the ones that I could find. If you will notice, the first column is where we are currently. The second column is what you approved last year. The third column is what we're proposing. And then the next few columns are the ranges that I found from other counties. We, for the most part, the ones that we're requesting kind of fall right in the middle. And then just one thing I wanted to remind you all of is you approving these today does not mean they go into effect immediately. They go before our county council first. They have the ultimate say. So for example, the salaries that you approved last year have not gone into effect yet because it takes county council approval. So just real quick, if you look down below there, the primary duties, the main reasons for changing these that we have listed these for is that we have changed their scope of work. So if you can look, deputy administrator previously was kind of primary clerical and personnel supervisor. And now we are having our deputy administrator address strategy, education, and they manage a much larger team. Before that person managed 6, and now they're managing 14. The administrative assistant, previously they were primarily responsible for invoicing and helping with food permits, and now they are doing invoicing. They have added the contract funding to their scope of work. This is not something they were doing before. They are also doing the food permits, We've added payroll and onboarding to them, and they're monitoring our finances and our books on a regular basis. The medical assistant, we have two. The first one there is for lead, and originally they were hired for lead case management and risk assessment. But with the addition of our STI clinic, are asking them to now do STI testing and phlebotomy. Immunizations, previously that role only did immunizations, and now we are adding STI, phlebotomy, and epidemiology investigations to their workload. And then our biller was primarily doing insurance billing, and now we are, of course, keeping the insurance billing, but they were primarily responsible for securing accreditation, which they did not come on thinking they were going to be responsible for. And we are cross-training them with the administrative assistant to do budget analysis. Any questions?
Are they picking up extra? Can you guys hear me?
No.
No, pretty loud. Are you, sorry, that's what I said, I usually don't need one. So, are they doing new roles because positions have been eliminated? Why are they getting more responsibility?
That's an excellent question, and it's because when I came on, I did a full kind of analysis of how our operations were running and put people in different positions and did a new strategic planning for our organizational chart. And so they definitely have new added responsibilities. It's not because of eliminated positions, it's just more work has been added due to the expanding health department and our operations.
Any other questions? Comments?
I think she told us exactly. From my perspective, he told me that they had not been, the salaries had not been previously proposed had not been accepted. So that gives me more information about what should be done in the future.
What do you mean by that? Like, what to be done in the future?
From what we do today.
Okay, got
Our decision making today,
it. Okay,
based upon what was just said,
okay.
I have, really want to hear this information now.
Okay, got it.
Yeah, I was wondering if you all were aware that that's kind of how it works, is that we seek your initial approval before we go to the county council, but ultimately they decide, and I will go before them and explain all of this to them and the reasons and the why. And they do have the ultimate authority to change your decisions. Maybe you'll approve something and they won't. So ultimately they do have the approval. We're just seeking your initial approval because then we go to them.
Why have they not implemented what we voted for last year? Like, why are we over a year behind?
So the main reason for that was, I think, just the transition of me coming on. Things got delayed in sending the proposals to the county council. And then once I did come on and it was time for the approval, we all know where funding is. And the county council has decided to freeze all budgets and positions, and actually even eliminate several positions that were vacant. So I don't even know honestly that if you approve this, that we're going to get it to go through. We're going to try, but it will be on the books that you've approved it. So when the time comes and they are willing to look at salaries, we can go with that.
So are you saying okay, I'll take number one. We approved from 76,000, this is the department administrator, 76,000, and last year we approved her to go to 80,000. And then we proposed, if we accept the proposed budget this year, it would be 87,000. So that's almost $11,000 in 2 years.
Correct. With the added work.
Any other comments? Can we entertain a motion for approval of the proposed salary changes? Any seconds?
I'll second it.
All in favor?
Maybe we should do,
Roll call?
Yeah.
What?
maybe we should do a roll call.
Okay. Let's go, you go ahead.
Oh, you want me to do
Yes.
it? Okay. Dr. Forright made the motion, Dr. McCullough. Dr. Hess.
No.
Bill, no, and then Dr. Dietrich.
Yes. Okay, the motion fails. So we'll move on to the next step. So where we are now is that the what we approved last time, which is 80,000 for the administrator, 44 for the assistant administrator, the MA 42,000, and then the visa 40,000. That's
Yes.
what's going to go to the board. I mean to
To the council.
the council.
Yes.
All right. The next item on the agenda is the new business, department activities and accomplishment report.
First, real quick before I launch into our accomplishments, I would, Denise, if you'd stop moving just for a second, I would like everybody to learn Denise Truly. She has now been named our HFI manager, taking out that role of coordinator of HFI projects and reviewing contracts and working with all of our partners. So we're really happy to have Denise in this new role.
Welcome.
Okay, how's that? Is that okay? So we wanted to take a moment at this last meeting of our year to talk about all of the accomplishments the health department has achieved in the last really year and a half or since HFI has come on. But really a lot of this would have happened even without HFI. The very top bullet there is implemented Health First Indiana. And that looks like a very simple bullet, but that took so much work on behalf of the health department, on behalf of our board, our health officer, our attorney Amishi, working up the contracts, us determining what direction we're going to go, what are going to be our priorities, coming up with the county health plan, and really guiding our direction. And then now, of course, our HFI managers are in place and they are reviewing all the contracts. They're communicating with our community partners. And so while it's such a simple line item, it really holds so much weight. And we're incredibly proud of the work that we have done in the health department. And here in a little bit, Michelle will run through the full impact of Health First Indiana. We added 6 new public health services. We modernized. We went from really a pen and paper health department to more digital. We have eliminated over 25 cabinets, which is amazing because we've digitized everything. And now we are adding new software to use in the field to eliminate that paper. I'm not going to read all of these, just kind of pull out a few of them. We've developed an education team. And while we had before people doing education, we are now focusing in on what that education means, who we want to educate, how we want to do prevention, and developing a team around that. Also, we've improved staff safety and customer flow in our building, which is really, I think, much more conducive to not only our staff and their security, but also to those who visit us. So I'm just going to take a real quick minute to highlight each division or each section of our department. Nursing. Nursing has taken on so much with Health First Indiana. Many of those new 6 core services that I mentioned are focused in nursing. As we mentioned before, we've enhanced medical billing. We've established 3 school liaisons who are a part of that education team. We've expanded our outreach, also a part of that education process. We have launched our STI HIV clinic, which we're incredibly excited about. We've strengthened our TB and lead case management programs. We've launched our mobile health clinic, which has been incredibly successful. Just such a great asset, I think, to the community, and people are now depending upon us to be in certain locations, not just at the health department in Crown Point. And we've introduced online patient scheduling for convenience. Our food and environmental, again, a lot of this is going from paper to more digital. So we have new software, we put in new training protocols, we've improved field safety through proper PPE and equipment for them out in the field. And one thing that we have done is we have decrease the cost of our testing of pool and beach sampling by changing who we are utilizing as our lab, which is saving us thousands of dollars. And increase community outreach. Our environmental and foods teams did not do much community outreach before, and now, as you can see, they're going to events, they're educating the youth, and they're participating in parades and different summits and different things to really educate the community. Planning and policy, we have really focused in on public health advocacy, speaking with our local officials, our state legislators, and really advocating for public health. We are now getting ready to launch a community needs assessment to get the input of the entire community as to what they think the focus should be and what the needs are for public health in Lake County. We've created a college internship program where we are partnering with several universities, both for medical residents, who are going to become doctors, and then nurses, and then environmental and foods. And we've created a menu of items that they can look at and choose what is best for their path and their education. We've expanded data collection, and now we are seeking more public health grants. In the last month alone, we have sought 4 grants, and we are waiting to learn if we get those. Vital records, really just digitizing our records and improving data security. And one thing that we're super proud of is in vital records, we have added online ordering and credit card payment, and soon we will be extending credit card payment out to the other divisions at the health department. I think you guys are probably noticing the theme of really kind of modernizing our department. Education and outreach. We have expanded our website and our social media, and we've improved language accessibility with using the Procrea app for language. We have also launched a prevention campaign, the Path to Wellness, which is a walking program that combines education and then everybody goes on a walk together. We are attending more and more events. For example, this is a picture from the Asthma Summit, in which staff are going out and handing out information, talking about the health department and educating the public. And then here is one from the most recent Veterans Day Parade, where our team walked in the parade. These are all of our current partners. So happy to work with our partners. Early on, Dr. Vavilala, and I think others of the team made the decision that, right, we can't do this all alone, and we really need to work with all of our amazing partners to accomplish everything that Health First Indiana encompasses. And this last year, Lake County Health Department received the Outstanding Partner Award from Tobacco Free. And then now I'm going to pass it off to Michelle, and as she's, oh, do you want to say something? That's okay.
Thank you everyone for coming again. So as you can see, we are extremely proud of a lot of accomplishments over the past couple of years or so. We have always worked hard here at the health department. However, the HFI funding has really propelled and given us the opportunity to bring a lot of our plans, a lot of our dreams come to fruition. We don't know where the HFI is going to go in future, right? We would really hope that it would continue to sustain. However, what we plan to do and what at least I would love to do and our department would like to do is sustain the partnerships irrespective of the money and the funding which we have. We have formed so many beautiful partnerships with the IU, with the Purdue, with the food bank, with the Sherwood Fire Department, in many, and we could not have achieved without any of it. And then we could not have achieved with the members of our public who come to our board meetings regularly, holding us accountable, encouraging us to do a better job over and over again, questioning when we need to do a better job. We truly appreciate your presence here. We appreciate your partnerships here. We appreciate our board members who are always giving us feedback. So thank you to all of you, because this is the end of the year, and we are very happy to see what we have achieved. And I think what we have presented, because of lack of time, is only a very small sliver of what we have been doing. And we have many more things we plan to achieve, and we would love to have all of your feedback. Thank you.
Okay, and then just to kind of explain the slide real quick, as Michelle gets ready to present, this is the total dollar amount that we have allocated through HFI. The green part is the total amount that we have kind of has been spoken for. The blue is how much has actually been paid out. So when she is going through her report, please think about how many amazing things have happened with just this amount of money.
Good morning, everybody. Well, now that you've heard just how hard we have been working internally, I feel like I'm very honored to be up here to show everyone how hard you all have been working to help us advance public health in Lake County. So thank you. In 2025, HFI funded partners across Lake County collectively, and we've reached nearly 20,000, over 19,000 residents, expanding access to prevention, chronic disease education, behavioral health, maternal child health, harm reduction, and much more. Together, these organizations have delivered over 700 workshops throughout our county and clinical encounters. They've distributed over 8,000 naloxone kits, screened hundreds of our residents for chronic diseases, and built measurable pathways to a safer, healthier community. Some of the impact that we reviewed is, like I had mentioned, we've reached over 19,000 of our residents with direct educational and clinical reach across all of our partners through Lake County. Through some of our partners, we've conducted HIV and Hep C testing. Combined, over 435 residents have been tested, and with that, we've had several positive cases that we've, 100% linked to care, which is amazing. Over 2,600 residents have been screened for chronic diseases through some of our partners like Indiana University School of Medicine, Purdue Extension screenings, and over 8,000 naloxone kits distributed for overdose prevention and harm reduction. Over 2,200 residents through home visitation, community health worker support, safe sleep education, and postpartum outreach have been impacted by maternal child health, and those are families that have been directly served. Over 600 safe sleep essentials have been provided to our Lake County residents, and those could be cribs, pack and plays, swaddles, along with education to our caregivers as well. Educating our youth, over 3,500 of our Lake County youth have been educated and provided substance use prevention and mentorship. 51 seniors have graduated from A Matter of Balance with Purdue Extension, and that is completing a fall prevention program. So they're learning, some safety practices to avoid those falls and injuries. Over 295 adults have received nutrition and chronic disease classes, and over 600 of our youth have been provided nutrition education as well. Totaling over 700 programs and classes across the community and school and clinical sites, engaging over 30 partners in cross-sector collaboration, and that is between us, that's between our emergency professionals, our FQHCs, our schools, and all of you. Some highlights we want to show is Franciscan Health, our community health worker program. 1,200 plus families have been impacted, leaving 133 women educated on breastfeeding and infant safe sleep. 114 women have been referred to OB care, improving linkage to prenatal services. The community health workers have provided a direct service encounter of 234 women or family, and indirectly benefiting over 1,600 infants in Lake County. Truly amazing. The Aliveness Project of Northwest Indiana, as mentioned, tested over 400 through HIV tests and Hep C tests, linking 100% of the positive cases directly to care. Also contributing to naloxone kits being distributed and harm reduction. Over 840 trained residents in overdose prevention, and have expanded their mobile outreach at events and conducting 47 education sessions. Hope Alliance of Northwest Indiana, in just 2 months, we have increased direct life-saving intervention capacity by distributing 2,000 naloxone doses across Lake County. 88 individuals have been trained in overdose response and 13 in mental health first aid, showing a strong prevention infrastructure. Over 30 families have been connected to food and housing resources, 10 women to prenatal care, and numerous referrals across behavioral health services. They've also been recognized by Overdose Lifeline, and that just goes to show their credibility in their work through the community. Indiana School of Medicine has screened over 739 of our residents for chronic diseases. They've improved health literacy and our youth's exposure to medical fields and education. Over 1,500 of those were residents. They've increased access to affordable care by referral to 180 residents to FQHCs while distributing over 900 brochures on chronic diseases and prevention education. They've also held 7 community health events, and they work with us to provide screenings in addition to all of that at our health department. Sounds of Sarah has distributed over 6,000 naloxone kits, lives potentially saved through overdose prevention. Raising greater awareness of substance misuse and response by training over 4,400 of our Lake County residents. Strengthening resilience and refusal skills among our youth by reaching over 1,600 youth in Lake County. 660 testing strips distributed, expanding our harm reduction access, and over 36 families have been connected to grief program and emotional healing, as well as linkage to care. And 3 naloxone box sites have been placed in Lake County, strengthening our community safety infrastructure. Purdue Extension, I did here combine, we do have 3 programs active with Purdue Extension, so they're kind of a little bit combined here. They have grown their community outreach from 3 to 10 community sites across Lake County. Cross-program integration, linking seniors to fall prevention, chronic disease classes as well. High retention, all of their programs maintain over a 95% attendance. Being that 94% identified healthy blood pressure ranges, 87% has improved nutrition label literacy, 96% plan to reduce sodium, fat, or sugar intake, and then partnering with other organizations like Franciscan Health, our health department, YMCA, parks departments, and libraries to expand access across the county. Our partners at St. John Mobile Integrated Health and Community Risk Reduction have established a strong community engagement collaboration across Lake County with 609 referrals to the MIH program. 324 enrollments show an effective screening and eligibility. Consistent referral to this is a 56.2% admission rate, and they've exceeded their contract projections with over 25 visits conducted. We've received direct reduction in emergency demand by 138 fewer 911 calls, and that sustained improvement in non-emergent use is 54.3% reduction per patient. 2 new vehicles have been added to the MIH program, which ultimately has allowed them to expand operational capacity, and they have now officially established 1 hospital partnership, improving patient targeting and efficiency. St. Jude House has provided 14 women clinical care, expanding access to primary and prenatal services, 3 women receiving postpartum support, over 60 families supported integrated physical and mental health recovery services, and 36 parenting participants strengthening maternal confidence and bonding, 62 housing referrals building a stronger pathways to family stability in Lake County, and licensed mental health services expanded trauma-informed therapeutic capacity. Mental Health America, we also have 3 programs that we are partnered with for the Infant Safe Sleep, I'm Somebody Special, and Gun Safety. Over 395 caregivers have been educated, and Safe Sleep Essentials provided to over 600 families, educating over 1,500 of our youth on anti-bullying skills, and increasing awareness in firearm injury prevention. For the love of arts, Shine Recovery Cafe has shown continuous engagement through hosting weekly sessions and serving 120 of our youth in Lake County. Substance use, mental health, and anti-bullying education has been provided to 38, held 38 prevention sessions. Building peer-led prevention and mentorship capacity by training 16 youth workers, and providing 181 rides thus far, removing transportation barriers for high-need youth. 4 active partners that are working cross-sector collaboration for youth referrals, and 6 family support nights have strengthened parental awareness and involvement. School City of Hobart has educated 220 parents on safe sleep, car seat, and home safety training, and has begun 7 home visits completed, personalizing support for high-need families, 13 developmental screenings and referrals, resulting in early identification and linkage to care. 11 families have been provided gun locks and smoke alarms, strengthening household safety. 4 families received safe sleep resources. 20 families attended Parent Cafe, which is a peer-led discussion and support. Expanding partnerships with the Lake County Health Department and Hobart Fire Department. And again, this is just in just a couple of months with School City of Hobart. Geminis Crisis Intervention Team has recertified 4 crisis intervention coordinators, strengthening leadership and program consistency. 24 first responders have been trained, police, fire, and EMS from 12 agencies countywide. 3 coordinators and 2 stakeholder meetings have enhanced cross-agency collaboration, and 6 new policy and procedure drafts are improving 911 and 988 crisis stabilization coordination. They resumed full 40-hour CIT training after the program was paused and implemented a cross-sector coordination between law enforcement, EMS, and behavioral health partners. And they've expanded recertification and curriculum development to maintain statewide CIT standards. In 2025, Health First Indiana transformed public health in Lake County through collaboration, prevention, and care. Together, we've reached more than 19,600 residents, delivering maternal and child health services, chronic disease prevention, behavioral health support, harm reduction, youth empowerment, and emergency integration. This collective effort built a stronger, more connected system where every resident, from infants to seniors, has access to the knowledge, resources, and care needed to live a healthier life in Lake County. The success of Lake County's Health First Indiana Network is a direct result of the dedication, compassion, and innovation of our partners. Thank you. You are all building a healthier Lake County, one connection, one family, and one community. Getting choked up there. I'll kick it out to Denise to go over our grant review. So thank you all.
Did you guys have any questions, comments, anything you would like
We
to
have-
say?
We have a lot of partners here present today. A lot of partners whom we have been funding and partnering with. And so please feel free to ask any questions regarding the presentation. We have a few minutes. That way we can proceed in going through the contracts for next year.
I want to say everyone has done a fantastic job. What can we do to make that 19,600 be 30,000?
So that is just, again, just what has been actually spent. So we have allocated that graph. These numbers will continue to grow. That's just what we have done directly thus far. I think we're on the right track. I think continue what we're doing, but I think that question is best for our partners.
Anybody else have anything they'd like to ask? Sue?
Well, if the partners have any ideas about how things are going to be next year to make things better, please share it with us so we can be in the mood with you for the next year.
Do you guys have any ideas on how we can continue to make these big impacts?
You guys can hear me, right? Yeah. I think going with the alignment of what you already said in your presentation of modernizing and kind of using social media to get the word out. The more of that we do collectively as the health department and us as partners, the word is going to keep going out. There's a lot more people that take social media into account versus like a postcard or a flyer or something like that. So I think the more that we expand the modernization of everything, especially in the local health departments, the more people are going to notice how much we do, and they're going to naturally start gravitating towards the resources that we are offering.
I would just add, I think you've done a great job building a comprehensive plan, touching on different pieces of your coverage area and different entities you partner with. But I like to think of it as a rock in the water. When you throw a pebble into the water, that first ripple is kind of what you accomplish so far. I'm just going to continue to expand this for your board and you're building this network. So I think it's going to be exciting to see.
I think convening, pulling us together is really, really helpful. I love hearing about and seeing all the different work that's happening in the community and seeing partners that we already work with regularly. It just helps kind of bring those connections together and make them stronger. There are already things we need to get connected. So I just really appreciate the time to come in here and I'm curious. These building programs, you actually those are very
I'm so sorry. We're gonna have to hold that for public comment part. Thank you.
You should ask if there's questions.
For the question was for the partner.
Their partners.
Yes.
Yes. They're the Health Alliance. They're partners. They're the partners that we just highlighted. Yeah.
Okay, board, any other comments on this?
No.
Ms. Cohen, you'll have a chance to make a public comment at the end.
Okay, one of the things I wanted to add, along with continuing the partnership, one of the most important thing I keep telling our health department to do is, we have a lot of services that we are providing or services that we need to provide to improve the outcomes, right? We want to decrease our maternal mortality rate, we want to improve our infant mortality rate, we want to decrease all those. However, there is always a question about, there are probably a lot of grants already in the community. There's already a lot of money that is being spent for the same things. So, along with partnering, along with funding some of these programs, we are also very aggressively, that this is our goal for the 2026, that we want to find out all the services that are available already in the community, all the grants or majority of the grants that are available in the community, and kind of make sure that not only we are going to partner in terms of just money, it is not about the money, but bringing people the awareness. When someone is talking about making sure that we provide this awareness through the social network and everything. So we at the health department plan to become the hub of information. We want to have all the information that is going to be available regarding all the services, whether we have partnerships with them or otherwise. All the services that are available in the Lake County, entire Lake County, the health department plans to become the hub of information. So people can reach out to us and we will be able to guide them to see where the services are. So that way we are not going to duplicate a lot of spending on the available services. That way we will be able to guide them and say, we don't have partnership in this, but these are all the partnerships. These are all the programs that are already out there, so you will be able to reach. So if you are aware of any of the programs that are out there that you would like us to know, so please do let us know. It doesn't have to be something that we are working with you, but we would like to have all that information available so that we can keep on adding the programs that are available in the community so that we will be able to share with the community members. Thank you.
Good job, you guys. Whatever they're paying you is not enough. So I wanted to just talk about some of the clauses that we have added to our funding contracts. We anticipated that this change was going to happen. We wanted to see how we were going to progress with the contracts as they were being filled. And as we imagined, there's going to be some funding that's going to be left over, and we address that in the new contracts and the renewals. So the first section, 9.3, addresses the two options that, if there is money left over from a contract and the program continues, the board can, going forward, approve to however they ask to reallocate those funds. If it's not approved, or if the program is over, let's say the contract is not being renewed, then now there is a clause in there that will allow a refund of whatever monies there are left over from any unexpected or unexpended funds. Section 9.4 speaks to that as well. Another section that we added under the termination of prior contracts is we are not, just to keep everything kind of accountable and moving forward, keeping everything kind of clean, instead of just having a re-signature to renew the old contracts or adding a rider, an addendum to extend it, we're going to terminate all the old contracts and have a brand new contract. I think that's just going to be cleaner going forward, especially as we're analyzing these contracts and these guys are doing all of their evaluations and reporting. There are some things that are going to work and not going to work, so they're working with our partners to make sure that the contracts going forward are addressing those scalability issues instead of, trying to cross out lines and re-sign old contracts and then putting riders or addendums to them. Any questions? No boring questions for the one?
Did you see that there was a lot of leftover funds?
No, actually, we have not. They've done a pretty good job of predicting. Okay, so that's one other thing that I wanted to talk about. If they run out of money from us, it is what it is. These contracts are for funding purposes. They're not to run a program. They run their programs. They can be funded by, we don't have an exclusivity contract with them. They can be funded by, whatever else. So I think out of all of the contracts, and Michelle can correct me if I'm wrong, or Denise, I think there's only two that had, only one. So, no, we're not finding that, but because we found it in one, we want to make sure we address it going forward. Okay, thank you for the question. You guys don't necessarily need to vote on it, but I did want to bring it to everybody's attention because when we start hearing about the new contracts and everything that we just saw that was happening, I just wanted the board to be very aware that we're now going into the second year, so there are going to be adjustments to the
These contracts are based on the funding that will be received for 2026.
Yes.
Okay, so these are our new contracts that are being proposed to the Board of Health. And our first one is Community Health Network, and their program is called the Buddy Bags. They are requesting funding for $34,470. And the overview of their program is Buddy Bags addresses food insecurities by providing nutritional meals to elementary and middle school students during the weekend throughout the school year. Schools served are in the Crown Point, Tri-Creek, Hanover, and Lake Central districts. Malnutrition due to food insecurity has been shown to affect cognitive abilities with lasting effects if the issue is not addressed. A student who returns to school not feeling hungry and not thinking about food is better able to focus and perform, and even less likely to misbehave or act out. Studies also show that these benefits increase if the students are started on such a program at an early age. The buddy bags are benefiting the students by serving in these ways. Our HFI committee gave this a grade between 1 and 5. We gave them a 5. The committee feedback was we wish they would expand the buddy bag program, and we thought it was a great program.
So with the scoring matrix, can you explain that a little bit? Is that a scoring matrix that you guys came up with, or is that something that was developed with the program prior to coming to us?
So this scoring matrix has been used prior. Sustainability, their deliverables, are they able to reach their goals, their metrics, and they scored 1 through 5. And so the way I did it, if the program, we had 6 people on our members, we got 2 of them that are here today. We had 6 that went through every application, and if they scored higher than a 4, then we moved them forward. So we gave them a 5. We thought this was an excellent.
So is that based on the outcomes that are supposed to be done with the evaluation of the program?
Right.
Gotcha. Okay.
Yep.
Good.
Do you have any questions for the members? We have Ms.
So, hi, I'm Dr. Hess. How do you determine what families received buddy bags and what actually goes in them?
Oh, I'm so glad you asked. And I want to thank everyone, not just for allowing us to be here this morning, but for your compassion, generosity, and your care for the community of Lake County, of which I've been a resident for 70 years now. I just had a birthday.
Wow.
Our clients are anonymous to us. The school does the vetting through their process of who qualifies for free meals through their program. So they remain anonymous to us. The schools do the vetting, give us a number of how many buddy bag students they have and how many buddy bags they will need on a weekly basis. We very carefully choose what goes into the buddy bags. It's breakfast, lunch, dinner, and snacks for 2 days. We're blessed to have a board member who's sitting behind me, who is a registered dietitian and takes great care and concern in choosing what goes in those bags. It's a challenge because we're dealing with, in some cases, preschools, and then all the way up to a 6th grader. So those caloric and other nutritional needs greatly vary in that age group. So not being able to say, okay, the kindergarten kid gets this and the 4th grader gets this. We have a regular amount of food in each category that goes into the bags. We unfortunately can't go student by student, but we do carefully monitor what goes in, and we purchase those food items to the Northwest Indiana Food Bank. They are delivered once a week to the schools. We do try to add a little bit extra for longer breaks. We always have to keep in mind, again, those youngest students and the weight of the bag. We'd love to put in a week's worth of groceries, but it's going to be a little hard for a 5-year-old to carry that in their backpack. So we do the best we can with what we have, and we're hoping to expand. We started out as a very humble program as a mission outreach of the Crown Point United Methodist Church. It grew rapidly from one school to now we're in all 4 school districts in the southern part of Lake County.
Thank you.
Any other questions?
So is this where we're gonna make a motion? Yes. I make a motion that we approve the funding request of 34,470 to Community Health Network.
I'm second.
All in favor?
Aye.
Yes.
Congratulations. Welcome to League of Icons. Okay, next up, we have Purdue Nutrition Education Program, which is the Healthy Futures Initiative. And their program is about chronic disease prevention and lead safety in Lake County. Funding request is $197,700. Their program aims to advance chronic disease prevention, obesity reduction, lead exposure prevention, school health education, and access to clinical and community resources across Lake County, Indiana, which excludes Erie and East Chicago. By using a multi-pronged approach of school partnerships, nutrition and physical activity programming, lead testing outreach, and linkage to care. Services will include school-based programs, hands-on learning, community workshops, and targeted outreach to increase health behaviors and strengthen school family connections. Our committee gave them a 5. We did have some questions for them. We wanted to know if there were any stipulations to the schools that they served. And they came back and told us, no, there were no stipulations to the program. All schools can benefit from this program. So in all, we thought it was a great program. Any questions?
Why is Gary and East Chicago excluded?
Because they have their own funding. Any other questions?
And we entertain a motion for approval. Any discussion?
My question is, don't we have several other organizations that are doing some of the same
No, this one's not renewal. This one actually includes the lead testing, which the other ones do not have that. So this is something new. But we do have, Purdue, I think, has a renewal coming up, but you know, one program can't reach.
But this is a new one.
This is a brand new program.
And $200,000 for lead.
Well, not just for lead testing.
But the other programs have the same.
I'm gonna let the partner talk, or is someone here from Purdue? Okay, thank you.
All right, so this is a comprehensive program. We have several different, 3 major prongs of it. Our first one is for the chronic disease and obesity prevention, is we'll be working within the schools. We want to reach schools through, and just before we started this, we talked with the health department and kind of said, like, hey, what are the gaps? Where can we help? What can we kind of help with? And so these were some of the things that we kind of came up with. Can't see. Is that better? So you don't have to turn your chair? Okay. So one of the, so school gardens, I'm hoping to reach 20 schools with new school gardens. Delivering nutrition education and healthy cooking demonstrations. With the schools, we want to reach the students, but also the parents. And so sort of just layers and layers of education there, with helping with social media and newsletter. There's the word I was looking for. Newsletters and things like that. Our next one is the lead testing and use management. So we want to work with the school or with the health department to kind of expand that access. And there's a nutrition component with that allows, you know, once you've gotten the lead testing and things like that, now what do you do? So like the nutrition helps you clear from your body, and then there's like the remediation in connection for that. And then working with schools, the school health liaisons that already exist, school assessments, and school wellness policies, just a variety of different programs.
I mean, have you already talked to certain schools? Like, to me, schools is such a broad term, like, and you're, Purdue's based in Hammond. So are you looking outside to make sure you get, the south part of Lake County? And obviously we can't do Chicago or Gary, but we gotta make sure we're hitting, Cedar Lake and St. John, Dyer, Hammond, like, all
Absolutely.
those areas around.
So Purdue Extension is actually the county service, so we're actually in the same parking lot right across over there. And so that is where this program lives, not at the university in Hammond. But we the people that are running this program would be me and my colleague Erin, and we've already been doing, we are very familiar with the partners in the county, and so we have a lot of relationships with a lot of different schools already. We would definitely open up to whoever wants to participate. You can't make people participate, but when you provide, funds for something and technical assistance and education and things like that, it becomes a very attractive thing. And we've heard from a lot of schools. A lot of schools do want school gardens. It's a great way to educate students on healthy eating. They get them involved, and kids want to eat healthier once they have their hands in the dirt and they do it themselves. They've seen it over and over and over again. So.
Okay.
I'm not Erin, I'm Megan. I do have to tell you, I work for Purdue. I'm the regional director for this program at Purdue and visit a lot of health departments, and you guys are doing a great job. I cannot believe how organized this is and how smoothly it's running, so thank you for that. But this is a multi-pronged, multi-generational approach, which I think makes it a little bit different. It's not working with just the students. It's working with their families, however that family system may look. And then it's working with the school as a community, and then the school as a community within their community. So it's multi-pronged, multifaceted, where it's not just, I'm eating just with you, and we're going to learn about healthy eating and growing a garden, but you're going to learn how to take that home to your family, and then how can extra food be used as a donation spot in a community, teaching people how to take what they're learning and share it with others. So there's pieces that can connect just outside those spaces.
And our approach is based in sustainability. So knowing that this money might not live forever, we want to have things in place where we train the trainer models and things like that can live on beyond what this money can do.
Any more comments or questions for the? No?
I believe that if they're offering prevention and education towards obesity, we get to hear every day how there's another med available to fix the problems. I think the sooner we start educating the young people and even involving their parents who probably didn't have the education themselves, I think it's a great idea, especially if the kids get to have a chance to learn how to do some of the things on their own. And I've seen it over and over. Even in South Chicago, I've seen fields that were previous steel mills that are now being converted to greenhouses so that the communities can have an opportunity to grow for themselves and the kids can learn earlier. I think it's a very important thing, and I think this, as we're watching insurance rates grow 30% plus without any extra benefit of educating anybody or preventing anything, I think it's very important for us to do it at a level where the children, I don't know how young you start. I don't know what the youngest school that you involve. Because we keep on handing bad habits down one generation to the next, and I think it's time we broke that. And even as educators ourselves, as physicians, It's something that we do not get in our medical school training. They teach pharmacologic answers for everything. So I think it's important to start, even if we just instill some interest in some of the kids. So I'd like to entertain a motion to Healthy Future Initiative pass.
Excellent. Any second to the motion?
Second.
All in favor? Yeah, the ayes have it.
Thank you.
Any oppositions? One opposition. All right. Very good. So we have about 13 more to go. We may not have time to do everything. We can, if it's okay with the boss, have another meeting before the year runs out.
I can just real quick.
Yeah, sure.
We do have a total of 15, but most of them are renewals that should go faster because they're things you had heard before.
Okay.
Totally up to you guys if you want to reconvene, but I think how many new ones do we have, Denise?
We have 7.
7 new ones,
Okay.
and then after that, the rest are renewals.
The renewals are no changes.
Okay,
to
all right,
anything.
all
It's just if you want to continue to renew.
I was going to propose the meeting to be, but Christmas party too.
Well, in that
Well,
case-
Christmas party.
Go ahead. Yeah, go ahead.
I can stay till 9. Okay. Let's go through whatever we can.
Okay, all right, sounds good. So the next one up is the Young Ladies with a Purpose. They are asking for $60,000, and the Young Ladies with a Purpose aims to empower and educate at-risk teen girls in Lake County, Indiana, through life skill training, mentorship, and access to health and wellness resources. The program services include bi-monthly mentorship sessions, workshops on life skills and wellness, and access to healthcare and community resources for 20 teen participants. Participants are referred by school counselors, social workers, foster agencies, and parent and self-referrals via their Facebook page registration. Young Ladies with a Purpose provides a safe, encouraging space for girls to learn life skills, set personal goals, and connect with mentors using evidence-based programs such as SAMHSA, CDC's Healthy Youth, and SMART goals. We gave this a 4.9. We did have some questions on how are the girls referred to you and how are they enrolled in your program, qualifications and certifications do counselors and mentors have, who are your current partners, show any evidence-based programs that are used in the program. They answered all of our questions in great detail. The committee agreed to move this program forward, and we thought it was an excellent program. Any questions from the board?
Any questions from the board, comments?
Do you have any questions?
All right.
I have a question.
Yes.
The 20 teen participants, is that for how often? Like, just as 20?
We have between 15 to 20 girls, sometimes more. I've been doing this for 8 years. The most I have ever had at a time was 15, and we operated for 3 years. During COVID, we had a small break, and then in 2022, I started having community events at the Mirabel Library, which I have about 4 to 5 community events a year. That's how I got introduced to you guys by Hope Alliance, coming in being a guest speaker. So between foster agencies, schools, YMCA, Mid-America, who we give flyers to, who we set flyers out, is there who meet these girls firsthand. So they make sure that if they think that, hey, mentorship would be great for them, they do pass my information along. December 13th, I'm having a resource fair, my first one. I have reached out to many other health facilities, Geminis, North Shore, May County Health Department. So we can just get aligned with each other and partner so we can have as many girls in this program as we possibly can. There's so many resources to reach these young ladies. So 20
Is that annually 20 or 20 at each event?
20 at each event is our goal.
Okay.
We want as many girls as we can to be at these sessions twice a month. Like, yes. And some will graduate. I haven't had young ladies graduate, go to high school, and we bring more. We're meeting people everywhere we go. Gymnasts have amazing events, and we go, we set up tables. So it might be more than 20, but 20 is our goal for each session a month.
Any other comment, questions? And we entertain a motion for approval. Any second? Any second?
Second.
All in favor? Yeah. Aye. All right. Thank you.
Thank you.
Okay, next up, we have Victory for Kids, and they are funding requests of $90,960. This program aims to educate the at-risk population of Lake County, Indiana on diabetes prevention and educate the youth on healthcare careers, financial literacy, disease prevention and screening, educating on obesity prevention through cooking demonstrations and meal planning, the youth healthcare career expos and after-school tutoring programs will educate youth ages 8 through 17 on healthcare, financial literacy, and disease prevention. We scored this at a 4.6. We just had a question about the amount for tutoring, which he did correct, so those numbers are right. And then the Expo CPR, Stop the Bleed, we wanted to know who that was being taught to. And we also wanted examples of supplies and materials for the Expo. She corrected the amount for tutoring. Students will be taught and certified for CPR. The neighboring schools can take advantage of tutoring, and examples of Expo supplies were provided, including props and learning materials for students. We thought this was a great program and it is sustainable. Any questions?
Any comments from the board? Mr. Goldie? All right, and we entertain a motion for approval. Any second?
Second.
All in favor? Any opposed? Aye. The motion carries.
Next up, we have Sounds of Sarah, Crisis Care Connection. The original funding request was for $200,000 and it was reduced to $25,125. The program aims to provide immediate, compassionate, and community-based intervention for individuals and families experiencing mental health or substance use-related crisis in Lake County. This program aims to reduce the reliance on emergency departments and law enforcement by offering a trauma-informed, culturally responsive mobile response model that meets people where they are physically and emotionally. The steering committee gave this a 4.93. We had asked if alternative grant applications such as the Lake County Opioid Settlement could be used for the program and only use HFI grant funding for billboards and marketing. We love the billboards and marketing for this program. They really bring awareness to the epidemic. The grantee agreed to pursue other funding for the entire program and reduce the funding request to $25,125 for billboards and marketing. Any comments?
Any comments?
Is this a renewal?
No, this is a new program. There's another Sounds of Sarah. Now this one is connection, well, here. Patty, I'm sorry, I'm speaking for you.
No, this is a new program. We have, Crisis Care Connection is sorry about that. It is our outreach, crisis, mobile accelerated program. So we have peer support, but it also is in connection with our current programs that we have. So it really is going to do like more peer support, crisis work in the community.
It's going to enhance it.
Enhance,
Yeah,
yes, it's going to be like an enhancement to what we currently have. But our billboards are going to kind of be the same, kind of through our website and stuff. But it is kind of a mobile crisis accelerated program. We received an alternative grant through the state for the mobile crisis accelerated program. So we're expanding Sons of Sarah significantly. And so we'll be doing a lot of outreach in that, and this will kind of complement that. So
So the amount you're asking is 25,000.
Correct, correct. So we'll be doing some marketing out with that. But we'll be also putting, Healthy First Lake County on our billboards and marketing material. So we'll be working with that. And, of course, we're very thankful for this.
The reduction in the ask
Yes.
was due to,
Well, we had asked for, a salary person and a vehicle for the rural kind of area for that. So we took that funding and we put it on the WITS element monies. I'm not really quite sure, but we did it. So we'll see what happens. That was asked.
Any other comments?
I make a motion, we approve.
Any second?
I say,
All in favor?
Aye.
The ayes have it. Congratulations.
Next up, we have the Boys and Girls Club of Greater Northwest Indiana. They are requesting $200,000. The Boys and Girls Club aims to empower youth to develop lifelong healthy habits and build resilience while ensuring staff are prepared to guide, mentor, and respond to the youth's needs. The program will serve Hammond, Lake Station, and Cedar Lake, making advances in chronic disease prevention by engaging youth in regular physical activity and nutrition education that promote lifelong healthy habits, while supporting the school health liaison goal through nutritional, physical wellness, and anti-bullying programs that foster positive social emotional health. Additionally, the proposed program strengthens trauma and injury prevention by providing CPR certifications and vehicle passenger safety training for club staff. We gave this a 5. We think it is a great program. One of our committee members said the Boys and Girls Club was there for me growing up and was a safe place for me to go to after school. Any questions?
Thank you.
There's one in Hammond, Cedar Lake, and Lake Station. Yes.
Yeah.
My question when we went through these programs last week is, of the 200,000, 120,000 was asked for salaries. So I thought 60% of the money that was requested was going to salaries. So I just wanted just a comment from somebody on that.
I'm Denise Keinke, VP of Philanthropy, and our CEO, Mike Jessen, is here as well. As you know, with children, and we serve children 5 through 8, and actually some 4-year-olds in some of our programming, the very most important thing is the adult teacher, our YDPs. One of the biggest indicators of future success for kids is having someone older and outside the family as a mentor. And our staff are mentors, they're tutors, they are coaches, and we have a ratio with the Boys and Girls Club to make sure that our kids, there's like a 1-to-15, 1-to-20 ratio with our kids depending on age and the YDPs. If we are to expand this programming, we need more staff hours, and they are the most important. They are the people who form those relationships for our kids. So the other aspect of what we do is that we basically provide these services almost free. It's pennies per hour. So it costs us about $2,400 a year to serve each child, and our families pay $50 to $75 a year. So we are not, it's pennies per hour to serve these kids. So we need staff to present this programming, and that's why that seems like a large component, but they're the most important piece of this programming and expanding what we do. We need more kids in, and we also need more teens and tweens, because during the pandemic, those kids flocked away from after-school programming. And as a community, we need those kids, those tweens and teens, in our clubs where they're supervised and protected, and where we help them with their schoolwork after school, and we fill those gaps for parents. So that's why it's heavy on people, because without the people, we can't have the kids.
This is actually a general question.
Yeah.
what is the impact of social media on the kids that come to you guys? Because a lot of them probably stay on their social media instead of human interaction, which is really scary.
Absolutely terrifying, and that's why we need club kids. The region needs club kids. When the kids come to us and when it's affordable for parents to bring their kids to us, they get supervision and they're not just sitting on their iPhones or their laptops or their pads. I mean, even all of their schoolwork is online. So much of their schoolwork is online. What we do and what this programming will do allows us to get them off the digital world. And, our Skilltastics, they're going to be learning activities, and, they're in the gym, they're in the STEM labs, they're in the, they're cooking, and they're learning how to feed themselves, and they're, all of the nutrition programming every second that they're with us and they're with these amazing adults who mentor them. They are not online being subjected to social media.
Excellent. Thank you very much. Any other comments, questions? Can we entertain a motion? Approve?
Motion.
All in favor?
Aye.
The ayes have it. Congratulations.
Thank you so much. We're so excited to partner with you.
Okay, we have Hope Alliance, Bridge to Health, Connecting Communities to Testing, Treatment, and Hope. Their funding request is $200,000. Hope Alliance will provide community-based HIV, Hep C, and syphilis testing, distribute harm reduction supplies, and deliver education on infectious disease prevention. Services will be offered through street outreach, mobile support, social media, and community partnerships, ensuring timely referrals to treatment and care. We gave this a 4.9. Our feedback was great to see them grow and offer more needed services. They are going to places where most of us will not. They truly are boots on the ground and always working to make a difference. Any questions?
Yes.
It's a renewal.
This is
This
new.
is new.
Same existing partner.
After here, we're going to talk about their existing program.
How many people are affected by the test?
I think they are going to talk.
Hello. You had a question?
How many people are affected, are taking advantage of the testing?
Right now, we're not HIV testing, that's why we're requesting them.
Yeah, this is a brand new program to us. Yes.
However, you already have a partnership with us. Can you
Yes.
speak a little bit about that?
Yes, so we, our partnership program that exists with you guys is already for harm reduction. So we are serving a lot of the communities with, like it says, boots on the ground. We have outreach on a daily basis, and we're doing a lot of education right now with it. And we're serving 600 people a week almost that we're seeing. And our partnerships have also grown exponentially. So now we're able to do referrals on a much larger scale.
One thing too, like my concern a lot of times when I see these programs is, okay, you get the test, you get the information, somebody's positive. Where does it go? Like who's following to make sure that this result gets to, the person? And you got to make sure Lake County that, we're using Franciscans, Methodists, Powers, like we got to be equally using, the hospitals out there and also the FQHC. So it's not always going to one, the results. But my biggest fear, I see this, it's great, you're testing, but if it's positive, who's following up on this information?
So the testing would be done, we would be under Lake County Health Department testing, so all of our testing would be turned in there. But back before the pandemic, I was director for Lighthouse Recovery Home. And when the testing came, we used Franciscan, that was who, so I've been there talking to them, and that as well. We have some online ones that for positives, because some of the people that we deal with substance use disorder are not going to be able to make it to Franciscan, which is in Munster. So we've researched some online places as well that we can refer them to. But everything would go to the Indiana Department of Health. So all all positives would go that way.
But I hear I don't have anything to do with Francisco. But I hear Francisco mentioned a lot. We just gotta make sure that
Yes.
we're equal to everybody out there, we're equal with all, the FQHCs and stuff.
And we contacted another partnership that is in Maryville that we're looking at, and we've been in communication with Planned Parenthood, because believe it or not, they do have, we can put referrals there as well. So, that was for the positives, who we can send them to. And we do send them for, now we have the clinic here, so, for STIs and stuff, but we've been using Planned Parenthood for that.
We do HIV testing here also, correct? So they'll be doing HIV testing.
The HIV testing that we will be doing is that we work with people with substance use disorder that are not going to make it to the health department. Just to give you an example, I show up every week to Salvation Army, and I have people that are in that area that come to see us for Hope Alliance for supplies, harm reduction supplies, the things that we give out, and they are constantly asking to be tested. So I have tried to get them, transportation is hard. So if I can on-site test, we would have another person there, and we can on-site test at Salvation Army, which is agreed to let us. The greater community of Northwest Indiana has agreed to let us test there, so we can do the testing as we do our outreach as well. And then I do go just to, like Gatehouse Recovery Home has 3 homes with over 30 people that are needing, they can be tested right now. So to get them to the health department, that they need, it's not just the transportation, so we have some of those barriers that Lake County Health Department HFI has helped with, but then you have appointments. Very hard to get people with substance use disorders to keep their appointments and make their appointments. So on the spot, we would be able to test them. And everything would be under the Lake County Health Department, all of our paperwork would go there, and everything would go into the Indiana Department.
So are you mostly going back to the same places to test over and over again, or do you try to expand your reach to other places as well?
We expand our reach, yes. So some of our, ideas in the future would be to go to like the hotels in the area. There's places that we would expand our reach to that. We do outreach there a couple times a month, we're able to, but most of that outreach has to be done at night as well, so that's when we reach most people, so we would definitely expand that.
And when you're, after you test or before you test, how are you providing the education? I mean, do you kind of give that information every time, or do you share that information every time? Do you encourage them to have their partners tested? Because this is the opportunity for a wider thing. It's not just one person test that we keep going back and testing. This is an opportunity to provide them education regarding prevention, and then for partner testing and everything like that.
So a lot of our comprehensive strategy for this program is going to be very heavy on the education portion of this, especially for the younger generations, right? The younger generations know the words HIV, syphilis, Hep C, all of that, but they don't actually understand the transmission rates, how easy it is to transmit, but how easy it is to get tested as well. And with the local surveillance of the high schools, especially, these types of things are starting to kind of skyrocket on us. So what we're trying to do is expand everything that we already have in place and make sure that we're going into those communities and talking with the people who might have a slight understanding of what this is, and kind of get rid of that stigma, so that way they can easily openly speak with their partners, parents, friends, whoever it is, to make sure that they can get tested too. And the nice thing about our expanded network is we will go to them. So we do not have to have them come anywhere. We don't have to have them sign up for anything, make appointments. Like Kelly said, it's really hard to get appointments for a lot of these individuals to make the appointment and then keep the appointment. So with our trusted faces and what we do in the communities already, they know they can come to us, and it'll be a lot easier for them to get the
And you also have a renewal request. Do we have a renewal?
No, we don't.
Any other comments?
As far as the outreach, you say you meet them or you see a lot of them in the evening. how do you get to them? Do you use your own transportation or?
We're gonna be getting vans, so we're gonna have outreach vehicles to be able to, get to where they are. But this grant we don't ask for the vans out of this grant, we were asking for it from government itself.
All right, any other
Your
comments
answer
or
to your
questions?
question is that yes, we do use our
We
own
use our own
vehicles.
vehicles right now.
I have an SUV and we use that, and so we never outreach.
One last question. We do see a lot of funding going towards the testing and doing a lot of these things. And there's a lot of funding out there, a lot of programs that are out there. Do you also work on trying to connect with each other to see how you can help each other and how not to duplicate the services? If someone else is going to the same places, do you do that?
Well, up until the health department has their, that you just opened, I think in October, the only community partner was Aliveness, and they are in Hammond, and it's very hard to get people to Hammond. I mean, I have the Gatehouse, which is in Hammond, and trying to get some of them to the Aliveness is very difficult, that's right there, And then the people that are in recovery homes, they leave the recovery homes. Homeland still stays in touch with those people. They still send us messages. They still look for our services. So, and getting them there, and then sometimes they're at Walgreens or other places, but that's what we want to bridge that gap. We're going to go to the people. We will be on site and we can test them. And we have people that send us messages that want to be tested, and because we're certified community health workers, we have peer recovery coaches. We have lived experience. I have 28 years clean. They know, somebody with substance use disorder knows that I know what they're going through. They feel the comfort, the safety, and the confidence. They trust us. The trust.
All right, now we entertain a motion. And second, all in favor?
Aye.
Aye. Okay. The ayes have it. Congratulations.
Thank you. Thank you guys.
Okay, so we are on to renewals.
Are we talking at the under the 3 minute?
Yeah.
What to do that still too, right?
One
That's gonna take.
option maybe if
This
we
is
time
what?
is if you want to do all the renewals at once,
Yeah.
or if you want to
Let's
hear
do
them all
all the renewals
individually.
at once, because if we don't get through them, I understand the board will not have opportunity to approve them this year.
Correct.
So let's do that since we already know what they do. Please, go ahead. All the renewals.
So we can just kind of give you an update. There really aren't, so all of the impact report, pretty much, no changes to the Mental Health America Infant Safe Sleep, no changes to the scope of work or budget. Same with the I'm Somebody Special, the anti-bullying program. So this is just, do we want to just continue with what we're doing? So no scope change, no budget change. The only thing with the Mental Health America, the gun safety education, is that they're requesting a shift in focus from families to providers and the flexibility in using aligned outreach marketing items to support the gun and general safety education materials at the vendor health fairs. And this, they're not asking for any additional money. They're just asking to adjust the scope of work. And then Purdue Extension, Be Heart Smart, no change in budget or scope. Indiana University of Medicine, the only change in the budget is that their first included equipment, so they removed the cost of equipment in their original, deducted that, so they had dropped their request down to $75,000 with the same services and scope of work. Also, they did have a little bit of the leftover funding, so this is subject to that section 9.3.1 that Anishi had mentioned. So again, same program. And then Franciscan Health Community Health Worker Program, same thing, no change to budget or scope. There is a slight change to the Geminis Crisis Intervention Team. The fiscal agent was formerly Geminis, and now it is going to be taken over by the Griffith Police Department as the fiscal agent, but no change to the budget, no change to the scope.
Why the change? Why the switch? Okay.
Hi, I'm Amanda Morse. I'm Director of Prevention Services at Genesis. We decided to make the change, the large body of coordinators, for sustainability of the program. It makes more sense for the money to be with the police departments. So, we partner with Griffith. We have a great partnership with them. So again, it's just a change in fiscal agent, and it was something that the coordinators all agreed on.
All right, thank you.
And then the only change with the St. John Fire Department, Community Risk and Reduction and Mobile Integrated Health, is that their original ask exceeded the $200,000 cap because we implemented the cap after they were awarded. So just in all fairness and being compliant with the $200,000 cap, we've broke that up into two contracts for funding. So you'll see one funding request of the $199,720, and then the additional one for the $64,900, and no change to the scope of work.
All right. Any questions or comments?
I have a question about the gun safety, switch from the families to the providers.
So we tried several times to advertise and get a community presentation. We were just not able to get enough registration of individual families coming to gain this education. Really did promote it in several classes, just had small numbers. So what we're really hoping to do is shift our focus and go with our providers. We have a network of dozens of home visitors, community health workers, school personnel. And what we want to do is provide all of that life-saving information. Look, we live in Indiana. This is not about should you have a gun. This is if you're a parent who has a gun in your home, how do you lock it up and keep it stored away from the children? We have to get this information out to parents. We tried. Again, making these community presentations, we just didn't get enough traction. So we are going to the sustainability train the trainer model. We want to get the information in the hands of our providers who are going into families' homes. What we're hearing from home visitors is that they aren't comfortable bringing it up. They're afraid they don't have the language. So we're working with the police department and their firearms instructors to be able to create materials to get it against our providers.
All right. I still don't understand families to providers, and the providers are the families, so.
We were trying to do direct education, so we were going to have community sessions, right, where we would train families on gun safety. And we did not get enough response of families registering for class. So we are shifting focus. Instead of trying to train families directly, we are going to train providers, home-based providers in the gun safety program, so that they can then go out and train families in the work that they're already doing. Instead of families having to attend a separate education class, we're training home-based providers so that they can provide the training directly to families.
Can I speak to that really a little bit?
Yeah.
My name is Erica. I'm a social worker for the police department in Griffith. So one of the things that we struggle with being an MOU contract with the school is that you'll see when everybody else are talking about reaching parents, it's important to do that. But guns are a weird taboo thing, so people don't want to talk to the police about their guns. They don't want the police talking to them about their guns. They associate that with either criminal activity or judgment or something that they think is going to put a layer of judgment on them for having guns. So what we realized and discovered was there were people saying, we really want the education and the gun law, but we really don't want the police to know our accident for it. So when Wendy brought up doing trainings and trainer trainings for people already going into the homes, like when I worked for child services, people would talk to me and didn't want to talk to police. So they'll talk to their workers and say, hey, if you get me a gun law, does anybody need to know? No, they can get them to know. They can give them the language. So the officers are willing to work with all of their home-based caseworkers and just say, hey, listen, this is the way to bring that up. It's not going to present added layers of fear for people. Like, oh my God, it's going to be kids, it's going to judge me for how parenting. You know, like when you said, guns aren't going away. It's not pro-guns, it's pro-gun safety. So nobody cares if you have a gun. We just want to make sure you're locking up. I mean, there's no such thing as an accidental gun. not an accident that it wasn't wrong. So the issue sitting on the fatality review team is every month there's a kid or 5 kids killed by guns at Fort Lauderdale. So we just don't care how they get the language or the information. We want to make sure that they're getting it. So if those folks
I
are
just
already
want to know
comfortable,
who the
that's great.
provider was, that's it. So you've given that source, you know, the social worker knows, it goes to the home, and she can discuss it, that's fine. You know, that's what.
Those are just some of the barriers that I think we face when people are like, okay, please. So,
And I think, I don't know, I would speak to getting parents to programs that are needed, and we know that the information is needed. You can have incentives and fun stuff there, games, rap prizes, you still can't get parents. If anybody can help us with that, to bridge that gap, that would be great. But I think, you know, going the provider route where these providers are already working with the families, they already have that audience there. And they're just not, they don't need the people coming straight to them where they would go to the providers.
Okay.
So-
All right. Can we entertain? Yeah. Did you want somebody want to talk?
So we have to do a motion for the
Yes.
renewal?
Yeah. We'll do a motion for all of them at the same time.
I set the motion to renew all the renewals.
All in favor?
Aye.
The ayes have it. So we're at the end of that. Congratulations. So just for fairness, I think we can entertain one comment or question or whatever from
Could I make
about
two
comment.
comments quick?
Yeah.
So
Okay.
my first comment is I would like to make a motion to formally start the process to remove one of the board members who I've been attending these meetings over a year and I've never seen him here. So we need to put people on the board who want to really provide and expand and promote health in Lake County. So I'd like to formally put the motion in place to remove TJ Wiggins from the board.
Whitmore? TJ Whitmore.
Whitmore.
Whitmore. Okay.
Whitmore.
Any second to that motion? All in favor? Aye.
My second comment is, and I should have said it earlier, is that I feel really bad about the pay raise that you guys offered. But I just want to say in 2025, the cost of living increase was 2.5%. In 2026, the cost of living was 2.8%. That's what it's going to be. Last year, we approved raises which were increased over 10% for the increase for 2025, and I feel bad they haven't been implemented. I can contact the board, you know, the commissioners, that's ridiculous. We approved it for 2025, and it still hasn't gone forward, that's ridiculous. I'm happy to contact them.
Thank you.
Now, also the raises that you guys asked for 2026, all of them were also over 10% again. 12%, 18%, another 12.5%. If you would come in at a lower percentage increase, I probably would have considered it. But to have 2 years in a row where you're asking for over 10%, to me, when the cost of living is only 2.5%, I found was not reasonable. I was willing to look at lower rates, but it was too much for me to say 2 years in a row. Yes, I want you guys to be compensated, but we have to be practical. Also, when the cost of living is only 2.5%.
I mean, we understand and we definitely appreciate your input, Dr. Hess. One thing which we would like to say is, when we came back to request a revision, we definitely were not asking for across the board as to what happened before. We were specifically asking for a certain number of positions that have had a change in scope of work. Either we can basically not change the scope of work and hire new people, which would cost more salary, more benefits, or we can compensate the people who are already doing the job and expect them to do a little bit more. So when we are asking for an increase in the salary, be it 2%, be it 5%, be it 10%, that was reflection not necessarily about the cost of living or the inflation or anything for those particular jobs. It was a reflection of their expanded scope of work. And we are trying to reduce additional asking for additional employees, right? We are asking the current employees to do more work. So we are saying only in that situation we have come back and requested an increase in the salary. That's my take on what you have said about the second one. And as for the first one, we truly appreciate. We went to the council, to each and every member of the council, of the board of council, and we did show them not that you have approved for the increase in the salary, but we also have showed them that we have made a lot of cuts within the health department to support the salaries. We have also have done a lot of revision in our fee structure. We have also are basically building the insurance companies right now rather than for people who have insurance. So we went back to the council and requested for an increase in the salary, and they have been supportive. However, they basically said this year they have had a salary freeze or across the board. But we would truly appreciate you reaching out to the council on our behalf
Right,
and
and I
supporting
have
us.
no problems doing that if we voted on it for 2025 and it hasn't been implemented. And certainly, I will reach out to
Thank
them
you.
and send them all an email and say, you know, we voted on this. We've over a year
Yes.
past. What are you doing? You know, so, but also, if you want to bring the data, I'm a very data-driven person. If you show me the budget of Lake County Board of Health and, you know, what the whole budget is
Yes.
and these increases,
Where it is being supported from.
where is
Absolutely.
this increase
Yes.
compared to that? Or
Yes.
like if you have cut other departments,
Yes.
so the budget is actually lower, but we can still support these few positions.
Yes.
I don't have a problem with that, but just to show across the board over 10%
Absolutely.
increase for 2 years in a row, how can, you know,
No,
I'm trying to be fiscally responsible
Absolutely.
also.
No, we appreciate and apologize. It probably was more of an oversight on my part because we have done that presentation to each and every council member. We showed them where the money was coming from. Hence, they were very supportive. We should have done the same thing with you. But if we have not, because
Yeah, I mean, I just, data,
Absolutely.
just show us data.
I will just add that I do think the market survey that you did show where you are in comparison with other health departments is important as well. Because I think in addition to, you know, an annual cost of living raise, you also have to be market
Competitive.
competitive. And showing where you are within the market, I think to me, made me be able to support the increase. Because you do have to be, you know, market.
But also keeping in mind that even across the board, all the other 92 counties, aside from Marion, Lake County, we do have a higher responsibility. That should also be reflective of the talent that we hire.
Right, to show what your yearly budget is, how many people you employ, have you got the, you know, what have you decreased, you know, like,
That was in the budget I submitted that you all,
We talked about that last time. I think combining this with that again, we have that next time.
Okay.
we will do. We'll come back and then, you know, I think given the limited time and the number of things that we
Sure.
needed to go through, it probably was not possible this time, but we'll definitely do that.
Okay.
Alright. All right.
Okay.
Any other comments? Well, comments from the floor. Can we take one or two so we can adjourn? Okay.
How many minutes?
Comments from the
3
floor?
minutes.
3 minutes. Just one. Yeah, one.
Please, go, you can go ahead.
Go ahead. Yeah, please go. Per person.
3 minutes, 3 minutes per person.
Yeah. Let's go where whoever needs to talk, we need to, let's go. Anybody that wants to talk, let's talk so we can. Yeah? Okay. Maybe give him the microphone, right? Yeah. Let's give him the microphone. Okay.
I want to thank you for moving the meeting location, excuse me, Frank Mill, okay, residence since December 18, 1995 in Lake County. Appreciate you moving the location, maybe the commissioners, or councilman's room would be a little more, I would say, efficient, but anyhow. Some of the comments I heard, and I will appreciate the miss, I don't know your name, on the end there, but.
Go ahead.
The questions that you went through, okay? One of the questions I've got here is that basically like the partners that are here, okay? Nobody basically identifies themselves. It's just, you know, they come out here to know what's going on. There was one that had billboards as the, one of their main things. I think it was a new grant they were asking for. My question is, have they asked Lamar, which is about the only billboard company here in the county, for any, did they give any, let's say, courtesy billboards for this nonprofit? Okay, and I don't know, and I'd like to know that information.
So this is an opportunity for the public to make comments. It's
Oh,
not a question and answer.
I'm sorry.
That's
You're
okay.
right. There's no questions. Okay.
Thank you.
The other comment, okay, so I made a comment about you giving us a better space to listen to you guys talk. The other comment was, I thought it was kind of odd where there was a program about lead issues for health, and there was no mention of asbestos. And I thought those two go hand in hand, so that was just a comment, not a question. Okay? Basically, the other thing was this situation about education of guns, okay, and gun use and things like along those lines. I would hope that and again, it's not a question, it's a statement. I would hope that that department has reached out to Lake County government when they have gun shows at the fairgrounds, that they basically bring their program down there and have it mandatory that if you're buying anything or looking at anything down there, please take this brochure and see what we've got. In the same sense, I would hope that they go to the gun dealers in Lake County and basically say, hey, when you sell a gun, okay, they have to go through a background check. I believe that's still the case. Why don't you give them information that they can pass off to those people that
Great idea.
And then I guess maybe the third statement is, I hear the word education so much in this meeting here, okay? And at the same time, I worked the polls yesterday for the, I guess the referendum for a increase in K-12 funding for Lake Central. I also got information that the new budget in the state has the largest increase, okay, and the largest funding for K-12 education, 5%, I believe it was. So everybody's jacking up the funding for education. It seems like we have a lot of redundancy. And that's not a question, it's just a statement from what I've heard.
That's
And I'm
fine.
sure
Well, you
with
can
the
keep
2 minute
going
mark,
if
so
you
I'm
want
gonna
to take the,
Pardon?
Ms. Sloan.
Yeah,
wants
I'm
to
gonna
talk.
step down now, and thank you very much.
Thank
Yeah,
you.
thank you.
That was really
Thank
nice.
you.
Wonderful. Thank you.
I also see a lot of redundancy. What I came here today to ask was, Bart can tell us. What I came here today to ask was, is there any interest in the health department about problems caused by toxic emissions? I never hear anything about that. I am a member of the Hobart grassroots group that's trying to prevent data centers from being built across the street from residential areas. I have contracted 2 billboards that are up right now on Route 30 in Mississippi to that effect. These billboards were only $400 together. Earlier, someone said, we'd like to know how we can reach out to the community more. I've stated billboards are a good idea, and I guess 3 months go by and everybody forgets everything, and we start all over. Anyway, these data centers have very toxic emissions that cause breathing difficulties such as COPD, additional cases of asthma, and in general, just respiratory and cardiovascular issues. I went through Sheila and had an email for Dr. Valvanala and asked her, and I'm sure you did, Sheila, send it to Dr. Valvanala and also to Dr. McCullough, because I believe you live across the street, right? You're actually living in the boundary. That's going to be a deficit. And I also contacted another board member asking if they would make a statement to the effect that these fumes will be dangerous. We have the mills on one side, and then we'll have data center on the other side, and nobody got back to me. There is a doctor from Porter County that would speak to this, but I thought it would be much better if we had a doctor from Lake County or a board member speak about that. And I do have some information here if anybody's interested in doing that. Thank you.
Thank you.
Thank you all. Any other comments, questions from the board? All right, can we entertain a motion for adjournment?
We'd like to go to
Oh, we do? Okay. All right. Okay, so we have upcoming dates for meeting, yeah? Yeah?
If anybody's willing to meet with them, we can,
Okay.
if you,
Okay.
when we're done with the meeting, if anybody
All right.
wants to listen.
All right, so we have an upcoming date for 2026. Board meetings. So any questions, comments? And we have to vote for it, right?
Yes.
Okay, so can we entertain a motion for acceptance of these dates for next year?
Yeah, I make a motion to accept the dates on the agenda for the meetings for 2026.
Any second? All in favor?
Yeah.
The ayes have it. All right, the meeting stands adjourned. Thank you, everybody, and congratulations to the grant receivers.
The Board of Health, look into these data centers and they're, they affect the environment.
the health department.
Great. So did I. It's yours. Would you like to put it on your wall in your office? You can take it.
Other pros and cons of the updates.
It's very easy.
I know, but I mean, like, I have no information. Brianna State Department. I cannot just go as a matter of state representative. Then you.
That's why I said I have done it with you. That we can have.
Who should focus on
The main person who's in charge of the business. The person who's trying, one of them is the mayor. The mayor has brought the data.
Have you talked to him? Okay, and what did he say?
He said he brings more finances to the community.
To bring more finances to the community? Okay. So
But
what
that's not helpful.
Thank you, guys. Have a good,
Thank you.
John.
I didn't hear you. All of our jobs, I mean, like,
You, I mean, I have been there, that's what I'm saying. But you feel up.
that's why if you want to put together a statement and we would like us to review as to what you think we should present, then we want
I know they drew that much. I know they drew tons of water. So I don't know the emissions.
Yeah. No. Thank you.
It's a
We can always.
Always.
Congratulations. I will look into it so I
I'm looking right now. It said four.
No, much, no, much.
So it's amazing.